In this episode, we're going to be looking at the impact that cancer has on the trans community and how it affects these individuals in a more unique and sometimes unexpected way. I'll be speaking to professionals and those affected to learn more about this often overlooked topic. To help me learn more about this subject, I travelled to London to meet up with Dr. Alison May Burner. After developing an interest in health inequalities for transgender patients, Alison chose to incorporate this into her portfolio career. How common is cancer in the transgender community?
Well, I guess the short answer is that we don't exactly know. The reason behind that really is that gender identity and trans status aren't collected that well in medical data across the world, really. And for that reason, when we try to look at incidence data, so how commonly cancer is occurring, we have to use lots of surrogate measures, which means we don't always fully understand exactly the patterns that we are seeing.
How does gender-affirming hormone treatment affect the risk of cancer?
So that's quite different depending on what hormonal treatment that you're having, but that will really vary by age and other risk factors. And other risk factors are really important. So in the case of breast cancer, you also need to think about whether that person might be at a genetic risk of a breast cancer, and the same in prostate. If a patient has that, then that's going to hugely affect their risk as well, and actually that's going to play a much bigger part in their risk than any hormones that you give them. But it's also important for us to know, so for anyone who's referring a patient to a gender identity clinic, check that family history for cancers, because it might determine how we advise people to proceed through their transition.
In many cases, patients do not want to disclose their previous medical or surgical history. How can primary care professionals talk to the patients and find out about previous surgeries and build up the rapport that's needed?
That's really difficult, isn't it? Because it's always a patient's right to talk about their trans status and their history, and it might be really uncomfortable for them. It may induce lots of feelings of dysphoria to bring that up. So it's very low on the patient agenda, but on the physician agenda, we want to advise our patients as best we can. So I think it's really important to go in with a good rapport with the patient to start with. I guess secondly, it's justifying all the questions that you ask, and I think that's really good practice whenever we take a history. We never know what's going to make someone uncomfortable. The patient might be really afraid about being denied treatments or that people are going to stop their hormones. That's a really big fear for the trans community. So you have to caveat with, I want to keep you safe. And actually reassuring people that you're not going to make snap decisions about hormones, and that decisions around treatment and gender-affirming care are always going to be made in concert with the patient. And then ask as you would for any general history. So I'm going to ask a question of all the medications you're on regularly, including things that you bought over the counter, things that you might think are just for your well-being. And again, surgical procedures, so any time you've had an anaesthetic in the past, things that even you might consider cosmetic. Definitely the most important thing is not to go digging and not to disclose to another member of staff or someone else that doesn't need to know about someone's trans status.
What resources are available for GPs or primary care to learn more?
So I know that the Royal College of General Practitioners has an LGBT health module which can be accessed, for example. I know for cancer specifically, there's a number of good e-learning modules around. Particularly at the moment, there's a European Society for Medical Oncology, and it's shortened to ESMO module, which looks at cancer specifically. There's lots of general information on charity websites for cancer as well, and for other topics. And then in terms of specific referrals around gender identity, all of the gender identity clinics and the new pilot services have got really great resources, even if the patient isn't perhaps under the gender identity clinic already. Our interest is the same as yours, just to keep people safe.
Wanting to learn more about cancer in the trans community, I spoke to Stuart O'Callaghan. Stuart is the founder and chief executive of Outpatients, a charity set up to support and advocate for people from the LGBTQI+ community who are affected by cancer. So how common is it in the transgender community to not engage with medical services?
So we know for the trans community that there is a lot of fear about attending to healthcare services, usually due to fear of transphobia when they get there, a lot of inappropriate questions. I have friends as well who have even avoided going to emergency care because they were afraid of how they would be treated as a result. So when we think about that in the case of emergencies, it's obviously entirely expected then you would see that for routine appointments, people avoiding. And especially because certain routine appointments, especially in cancer, are quite often to do with anatomy and sex assigned at birth and things like that, that can create greater fear about attending and being treated with respect or having the process done in an equitable way. But it's really a myriad of reasons as to why people are not presenting. And in this case of cancer, that's obviously concerning because then a longer period of not going for routine diagnostic tests is really a further chance for cancer to proliferate and develop in a person without them really knowing.
What can primary care do to encourage better engagement?
So I think primary care has a duty to understand that they need to reach out to the community. So it's sometimes seen that community has to create their own pieces of work or ways to bring people into healthcare, but the reality is people say there's no point you sending me into the service if the service hasn't improved. So primary care really needs to find a way to demonstrate that it has improved. And that can either be by engaging with the sector and community groups to create campaigns or evidence of training, things like that, but also just improving the systems and the processes. So whether that's making sure that in screening invitation letters actually go out to the people that need them, or that they are gender inclusive and gender neutral in their language, or if they are struggling to invite trans men for cervical screening, for example, that they're using available guidance that is out there to find workarounds with the current system whilst we wait for an update from NHS Digital. So when we think about primary care, we often just put all the weight on the GPs, but it's also the whole clinic and the whole patient experience throughout that. And that includes calling up and asking for an appointment. Also thinking about the posters you have up, the information, is it relevant, is it affirming? So it's really about making those extra steps so that we're not leaving people behind.
Are there different or additional challenges seen even within the transgender community?
So within the trans community as well, we have to be careful not to just always talk about the trans community. So because there are differences between certain groups. So if non-binary people, if you look at the GP patient data, they typically have the poorest experience out of all groups of people who identify as trans. So another thing to consider is intersectionality. And the way that this means we're not just only dealing with a trans patient, they are also multiple things at the same time. And those other aspects of identity can create barriers to the healthcare, but also the way these things intersect creates unique barriers. So for example, we sometimes see trans-related content or booklets coming out, but very rarely see it in other languages. And also when we think about trans people, a lot of stuff is aimed at young people, but when we think about cancer, this is primarily affecting older people. It's this difficulty, I think, sometimes when people talk about trans health, they think about it as complex. However, all health is complex. So when we think about it, it shouldn't be a barrier, this complexity. It should just be something that we make an effort to understand so that we can best support the patient.
Currently, 62% of trans patients report a lack of understanding of their individual needs. I wanted to speak to someone with lived experience. I met up with Anthea, a trans woman who was diagnosed with prostate cancer in 2006, prior to her transition.
I got put on a PSA surveillance programme as a part of a Bristol prostate cancer research group, and my PSA started to go up, I think about to 8, and then I was given 2 successive prostate cancer biopsies, and I opted for radiotherapy, external beam radiotherapy.
Off camera we were talking about your experience and the surgery that you've had. Can you explain a bit more about trans women, and if they do present with certain symptoms, what GPs and primary care need to be aware of?
Trans surgery never gets anywhere near the prostate. It's always left intact. We are as subject to prostate cancer as men. Hormone-resistant prostate cancer is a rare but relatively well-known situation.
Okay. So if I see a patient who is a trans female who is presenting with symptoms that could represent a prostate cancer diagnosis,
yes,
you almost need to have the confidence to actually say, can I examine you? Can
yes.
I take a full history?
Yes. Again, in terms of diagnosis, there are problems.
Yeah.
Because some of the treatment may upset PSA levels. If you're on anti-androgens like Decapeptyl,
yeah,
it can reduce the PSA to 0 and therefore requiring other methods of looking for the prostate cancer.
Oh, I see what you're saying. So you're saying that actually we can't just look at the biochemistry.
Correct.
So just to understand, there are certain medication, you mentioned the medication that you have been on.
Yes.
Can reduce the testosterone levels and can reduce PSA.
Yes.
So actually we need to take a full history, a full examination, so we can't just look at the numbers.
Correct.
How should primary care ask patients, particularly about their anatomy and what surgery or what procedures that they've gone through?
The clinician needs to know precisely what the current anatomy of his patient is, both trans men and trans women.
If there's been different surgeries and medical notes are not up to date, then actually it's important to ask the patient themselves, because
Yes.
they'll be fully aware of what they've had.
Very much so.
With a trans patient, is there anything how we can educate? I know that you used to give books and you used to give learning aids to your GP, but there's not as many people that can do that. Is there any key points that you would say?
They need to understand what a trans person is, what their problems are. I mean, they may be vulnerable in other ways. I mean, I know patients who attempted suicide,
Yeah,
have lost all relationships with their family,
yeah.
and have other mental health issues. And I think one has got to look for all those other symptomatology, as well as their purely trans issues.
The whole picture.
The whole patient.
Yeah, the whole patient, absolutely. I see a lot of younger patients coming to see me who want to begin their transitioning. I think it's a big job in general practice to actually support the young people and their families while they're waiting for the gender clinic. Do you have any advice about how they can best look after themselves in preparation for seeing the specialists?
I think that they should also try to find a local trans support group.
Yeah.
There are people there who've been through the cycle and can tell people about the process.
Meet other people who are going through similar.
That is most important.
Yeah.
Don't be isolated.
It is difficult to talk about cancer in the trans community without the accurate information. However, it is clear there are barriers for trans people accessing healthcare. We need to reach out and engage with these communities that have had negative experiences, build good relationships and support patients that may fear that their hormone treatments will be stopped. Ultimately, we're all working towards the same goal, improving patient experience and outcomes.